Hello, and welcome to A Renewed Life Global. Discover secrets to heal emotional wounds, set boundaries, and move forward. I am your host, Dr. Beverly Carter. And the title of today's interview is Connecting Trauma by Reconnecting to Self. And we welcome Dr. Erin Holston Singh to our platform. In 25 years of practice as a naturopathic physician, Dr. Erin Holston Singh has helped thousands of individuals overcome chronic illness and optimize their lives. Always grounded in naturopathic philosophy, she ties the latest scientific findings back to the guiding roots of homeopathy and nature cure, the 19th century origins of naturopathic medicine that trust in the healing power of nature that preceded the scientific revolution. Practicing and studying heartfulness meditation since 1992 and serving as a volunteer trainer of this method since 2008 laid the foundation for her spiritual development and capacity to attune to nature's messages, thus serving her professional development. In her clinical work, Dr. Erin has a particular focus on the developmental and emotional relationship to disease. Her background and postdoctoral training in Gestalt therapy enabled her to master the art of patient care with a thorough exploration of the emotional connections to disease processes. The German New Medicine, the specifics on how the mind codes the nervous system to program disease, guides her medical worldview and assessment of patients. Dr. Erin Holston Singh, I welcome you to our platform. I'm so glad you're here.
Thanks so much for asking me. I'm honored.
Actually, we're honored to have you, really and truly. There's so much about naturopathic medicine and homeopathy that we really need to better understand, as well as the whole Gestalt concept that you're very well versed in, as well as the mindfulness meditation piece. I think it's all what body, mind, and spirit, right?
Yes,
In
absolutely.
this healing
All
process.
the same thing.
Yeah, yeah.
Big part of my message.
So, so thank you again. So let's see, how would you define trauma?
Well, I think of trauma as really any experience that a person has that essentially and fundamentally they cannot accept. So people often think of trauma, as like abuse or, severe psychological events. And it may, of course, be all of those things, but it can also go all the way down to very minuscule, minor, small experiences that we have that may be repeated day in and day out that the person cannot accept. And it's really that moment of not accepting the trauma where I believe there's like a disconnect that happens. There's a disengagement where, because of the lack of acceptance, the person separates from their true inner being because they're not accepting what's happening in the moment, their life. And then it really becomes a probability that they would continue to like almost recreate the pattern of the trauma over the course of their life. It's almost like a fractal experience where, if you come into this world and you experience a particular trauma, there's even, some folks that have figured out mathematical relationships in time where those traumas will repeat themselves. But I think it's, when I talk to patients about this and I suspect or know, or they know that there's been some kind of trauma in their past, a lot of times I really do just kind of focus with them that it's not about what happened, it's about their perception of what happened. That's so much more important than the actual event, because everybody has a different response to different events. And the trauma is really in how we relate to the event.
Yeah. Yeah. Oh, I love that explanation. It's interesting how we go into survival mode so quickly, right?
Our nervous systems are wired for that, right? It's
Yeah.
all about, the relationship with the environment and that experience and how that comes in
Yeah.
and out of the being.
Yeah. It's almost like in some cases we might just compartmentalize just to like find a way through, as opposed to, or maybe I should rephrase that and say find a way around, as
Right.
opposed to
Right.
going
Right.
through.
And I always say the only way out is through. When people have anxiety, it's often just really the fact that they can't deal with those suppressed emotions that are in relationship to these events. And if they would just allow it to come up and move through it,
Yeah.
they
Yeah.
no longer have to circumvent.
Yeah, gosh, that was a powerful tweet before, absolutely, about that. And as I think about it, because that is so true. It is so true. The best way is through those events.
And it's scary, very scary for people when they have such powerful events that they can't accept, and the emotions feel like they're going to eat us alive, right? So you
Yeah,
can't
really,
possibly let
right?
those emotions come up. And
Yeah,
and then all, layer caking all those years of suppressing
yeah,
in order to manage becomes a modus operandi that doesn't serve
yeah,
us anymore in
yeah,
years past, and
yeah,
certainly doesn't serve the physical body.
sure. Yeah, not at all. And I love that you're describing it this way, and I can really relate to what you're saying here. And what what really comes to mind as I think about it is simply the fact that it's completely subjective. We know that, but the fact that we often don't remember the events as they happened. I mean, sometimes we recreate it as we repeat it over, and slight things change with each recreation of the memory.
Yes.
So, how do we then approach the stress that encompasses the experience, the traumatic experience for us?
Well, whenever I have patients that use the word stress, which you will find that people do on a very regular basis, and I'm always pointing out to people, did you know that the word stress was coined in, I think it was 1950 or 1952 by Hans Selye? Like, that word is a really recent word in the lexicon of the English language. And
Mm-hmm.
what is stress? My first really true mentor that I had was a French medical doctor who had kind of shunned all classic medicine, as he called it, and was using all the holistic modalities of the world: Chinese medicine, homeopathy, anthroposophical medicine. And he would say that his one of his favorite quotes of mine that I immediately wrote on a post-it note and like carried around with me in different notebooks in my office for years, was that stress is a communication problem with the self. So the stress is really about how we manage what's going on out there in relationship to our interior and our consciousness and our interior experience. So there is no generic stress that people want to just, like, I never let my patients get away with just saying, well, that's very stressful, or that stresses me out. And I say, well,
Yes.
what's that mean? And I really dive into what are the exact experiences, and even more specifically, what are the exact feelings that you're having in relationship to these events. So we think about stress as being, well, I have to hurry up and get this done for work. But fundamentally underneath that for a person can be the fear that they won't be able to keep their job or maintain their job or succeed in their job and then lose their job. And then it's really like it's like a survival. It's a fear for survival because they're not going to be able to make money. And then, again, they're not accepting what the universe is giving to them. But of course, I understand that people also need help just getting out of the modern lifestyle and
Yes.
the American way that's all about go, 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 and achieve, achieve,
Yeah.
achieve, and earn, and make money. That we've created this world that is killing us.
Truly. Yeah,
Truly.
truly.
Truly. We're seeing it every day. We work with stage 4 cancer patients a lot here. working with cancer and helping people understand how that cancer is just the end result of a lifelong and, possibly usually even a multi-generational, transgenerational process that they're repeating. The trauma goes into the next generation, and we're all here to work some part of that out for the larger collective. So stress is just such a poorly used word. It's kind of like when people swear because they don't have a good vocabulary. They say stress because they don't know how to identify and recognize and speak about their true feelings. And one of my biggest passions in my work is really helping people to raise their awareness and their awareness of themselves, their relationship of their self to other, and how they interfere, how they communicate, how they are in the world, and what they can do to really make a bigger difference.
That's awesome. Now, is this, common among naturopaths? Is this a part of the work that you do, or is it just your spin on how you do your work?
Well, that's definitely a good question. Every naturopathic doctor is so incredibly different because there's not this standardization of we do everything exactly the way all other doctors are. And, some naturopaths would really like there to be a standard of care, and they become more like primary care physicians out like in the Western and Eastern states where naturopathic medicine has been very well established. But I would say that this is really my very uniquely amalgamation of things that really took my work and my study with Dr. Gagnon and the work with the Gestalt, which, there's a big Gestalt center here in Cleveland, and an organization systems development, OSD, Gestalt OSD center that's now also working with Heartfulness here in Cleveland. And then also the work with the German medicine and recall healing. Those are two separate things that come out of the same lineage of Dr. Reich Gerd Hammer's work, who was a German physician who did a exceptional amount of research about how the psyche and the experiences code through the nervous system, the physical body, various disease processes and cancer. And unfortunately, his work was originally accepted in the, I can't remember the name of the university, but it was in Cologne, Germany. They initially accepted his research because he was looking at MRIs of the brain and seeing swelling in the brain when people resolve certain psychological conflicts. But then when he started to bring in the concept of microbes and the purpose of microbes, they couldn't accept this because, of course, this would completely throw everything that's done in conventional medical systems, would deny all of that, and they couldn't integrate that. And so therefore Dr. Hammer had to go, and he was ousted from Germany and came to Canada and then eventually Norway. But in any event, that whole field of thinking, like my life was spent truly trying to understand the emotional relationships to disease, because my mother's mother had died when my mother was 8. And I just inherently knew as a child that had something to do with the way that my mother was. And then lo and behold, my mother developed a severe neurological disease when I was 15, misdiagnosed as a schizophrenic for 2 years. But ultimately, we came to understand that this was really a neurodegenerative disorder. And so it was a quest that I, kind of started at a very young age, and then just expanded from there. So it's definitely my kind of unique, what I think of as my life's purpose, helping other people to understand these relationships. And it turned out to be really incredibly effective in the work that I do with homeopathy and the methods that I learned from Dr. Gagnon that I'm trying to now teach around the world.
That's awesome. Yeah, very powerful. So what is developmental trauma, and how does it relate to chronic illness?
So developmental trauma, there's lots of different ways that we can think about this. So we were talking about that disengagement that happens whenever there's an experience of something that you can't accept. So, we think of in more of a conventional medical setting, trauma and trauma-informed care and all these terms that are coming about in relationship to the phenomenon of the adverse childhood event score, or an ACE score. It's a measure of 1 to 10 of the types of experiences that have happened. You probably talked about that in some of your previous summit interviews. So we do, ask people about their ACE scores, but it's also really just, again, about like any experience that one could have, whether it's physical trauma. So, I had one patient once who had a surgery when they were 6, and ever since then they had a certain set of symptoms that they could never really get fully resolved. So that was, a trauma that happened physically. And then you can have more chemical trauma. So maybe it's from the impact of chemical exposures, toxicities, maybe chemicals, pharmaceuticals. Pharmaceuticals are chemicals, and they do have a more biochemical type of trauma that disrupts your normal physiological mechanisms in the body. And then, those are really like mechanical. They end up becoming like mechanical interruptions and mechanical trauma. And then, of course, the one we typically think of is the psychological and emotional trauma. But developmental trauma is the sum total of any of those events that happened during the developmental years. And, I think of what are the developmental years, really birth, any gestation, of course, birth till puberty. And then even from puberty until 28 is like the last quarter of a 28 years that it takes to become a fully developed adult. So there's many things that we can do to help that, but that's developmental trauma is really, whenever I see a whole different, multitude, variety of symptoms and issues that are going on with the patient, I have to know what happened in that person's childhood, because you can almost always see that fractal of experience that shows how what had happened then is getting recreated now. And that's really Gestalt, right? I mean, Gestalt is all about like how is what's happening in the right here and now representative of the bigger picture. So
yeah, that's a powerful connection there. Yeah. As we go into the winter months, and I know, we've got the whole daylight savings time thing happening, and normally it's understood that some people tend to feel more depressed, and they have the whole blue light thing that some people may use or do to help alleviate some of that. How would you suggest, how do we support mood and mental health issues?
Well, there's absolutely so many different modalities and therapies and treatments that you can do. I mean, I've worked with multiple different techniques and options, depending on the person and depending on how they particularly present. If somebody has just your classic seasonal affective disorder, we might just look at using something that really helps to support this concept and this sensitivity to darkness or lack of light. And that could be something as simple as using the flower of St. John's wort, which is a yellow flower, and it gives a lot of light to the pineal gland. Or we might look at using different homeopathic medicines. The one that immediately comes to mind is homeopathic gold, which is gold, right? So it's also a lot of light, but one of the classic symptoms of that remedy is sensitivity to light and seasonal affective disorder types of issues. And then going beyond just seasonal affective disorder and people who tend to have depression and mood issues, there's this lovely way of formulating homeopathics in a very particular method where we give remedies essentially once a week. And it's like what they would call in France a pluralistic homeopathic method. So unlike classical homeopathy that just gives one remedy that's trying to mirror the sum total of the individual, this method is really more about helping the different facets of the different behaviors, and not thinking that we have to rely on one single medicine, but that the human body is infinitely complex and infinitely able to respond to different types of information, vibrations, healing messages. So it's really like this little package that we put together. We call it the temperament balancing program or temperament support. And
Got it.
it's been really fun to use it because I've actually been able to help an uncountable number of people get off of antidepressants,
Oh God, that's
anxiety
awesome.
meds,
Yeah.
ADD meds, birth control pills. Like those are the biggies where you see people having issues with anxiety, depression, irritability,
Mm-hmm.
like anger issues, that type of thing. I
Mm-hmm.
mean, it really, we don't need pharmaceuticals to help people with those issues, but people just don't know how, what, and where to go. So that's part of what we're trying to put out there to the world and say, hey, this can really help you. And,
Yeah.
I historically had really only done it with current patients. And now we're offering a couple of different programs where we're giving people either a 4 or 5 week program or a three month program to do that. And been doing it, and people are getting, the same kind of results. And,
Yes.
it's just, I think it's important to also let people know that if you need more support, like here are these other resources for you. So it's not
Yes.
the type of thing
Yeah.
where we just say, oh, stop taking your antidepressant and take this instead. No, not at all. It's more of a process. And the two aren't mutually exclusive. Like someone can do this program while they're on pharmaceuticals, because there's absolutely no possibility of interference when you're talking about homeopathy and pharmacology, because homeopathy is vibrational medicine. It's energetic medicine. And that's why it's alternative, because the conventional world doesn't understand what quantum
Mm-hmm.
physics has put out there for us, even
Yeah.
though we really should integrate the fields of biology and chemistry and physics, because it's
Yeah.
all the same thing. But
Literally.
we like to
Yeah.
keep it all separated so that we can, reduce it all down and look at the parts and understand the molecules and think that we can explain the totality of the human by looking at through this reductionist lens. And it's
Yeah.
just really, there's a limit to it. You can
Yeah.
search and search and search and search and search for a molecule, but we don't even really understand what's happening in a live body in the tissue when there's a drug that's interacting with a receptor. Like we have ideas, we have conceptions where there's been lots of research that help us kind of conceptualize what's happening, but it's not like we're going in with our electron microscopes into the
You're right.
minutia of a living being and really understand what's happening in
Yeah.
some total of it. So it's a lot more mystical, and it's a lot more complex and spiritual and cosmic, I think.
Yeah. Wow. Yeah. Absolutely. When you explain it like that, absolutely, it is. So you have a program that you put together called the program. I feel like I'm like program.
Well, I have
What
a
is
site.
that?
Yeah. So the OM program is really, the title that I'm choosing to redevelop and rebrand a concept that Dr. Gagnon and his colleagues came up with that was called the brain protocol. So we've been using this brain protocol for years, but I'm choosing to now call it the OM program because
Okay.
OM refers to two things. OM is the sound of what came out of original source or the absolute. It's the original thing in creation was this vibration that in Eastern mystical thought, the Upanishads and the Vedas of ancient India, they called the Utgit, but that sound Om is the original source. So it's what is source? It's corrective. So there's that part of it that I liked about Om. But the other part of it is that the brain protocol, to call it the brain protocol, really misleads people into thinking that it's just about healing the brain. But this is really about correcting the developmental period. So the
Yes.
OM stands for optimal maturation.
Okay.
So what we're really doing with the OM program is we're going back with homeopathics, corrective energetics, and helping the person reconnect to where they had disrupted the connections between the endocrine signaling from the glands with the nervous system, with the organs of the body. So everything is developing in sync. So you have part of your brain that's developing when you have you're an infant, that's related to the adrenal function and the digestive organs. And then it moves into the thyroid development and the midbrain or the limbic system with the liver. And then it moves into more of the cerebral cortex, pituitary gland with the kidneys and the lungs. And there's then two pieces that go on either side of that. One that I'm adding on that has really more to do with that original kind of phase of development with the pineal gland and the heart, because I really believe that, the first cell is in the heart when there's the moment of conception, that we really come out of source and we come out of the heart. And then there's another phase at the end of those 4 phases that has to do with the puberty, the pubertal phase. So the gonads, and that really isn't so much about sexual development as much as it is about like awakening the willpower of the child in that transition to an adult. So it's really taking Dr. Gagno's work and kind of adding on my 20 years of experience with it, using it, and helping people reconnect from when they've had traumatic experiences or even just grew up in a household where there was a lot of, verbal abuse or, poor boundaries. You mentioned boundaries in the title of your summit, right?
Yes, I do.
I really have seen, just repeated cases of people who grew up in a household with horrible boundaries, and then the person ends up having autoimmune disease. And the way that we think about that is it's the development that happens in the child over those developmental years that's really developing the identity of the self. And that is tantamount to their immune development. So self-development equals immune self and identity. And when that's constantly being violated through any degree of a boundary violation, then that child will be an adult who has a greater susceptibility to autoimmune disease. So, I don't think autoimmunity is one of the most well understood components from the conventional standpoint. And, they don't really have any treatment for it. They don't have really much therapy, but when we can get someone to really stick with our processes and help them move through that and develop an understanding of it, and then try to put the pieces back together and move through what can happen when you do start to reconnect and you start to discharge toxicity, which may look like an acute illness, then people can really heal from chronic, long-standing processes that are now manifesting as, this, that, or the other disease.
Yeah. Oh, wow. Yeah. That's powerful. I mean, when you're thinking about autoimmune, I'm hearing you, and I'm also thinking about endocrine, they don't know a whole lot about that either. So it's,
there's a lot more that can be done other than just giving hormones to overpower your endocrine system. And one of the things I like to point out to people is that your hormones are really your feelings that have become physicalized, feelings that are now converted into hormones that are signaling throughout the body. And, the hormones are your most sacred secretions. They're the molecules that have a very powerful effect all throughout the body. And likewise, that's why it can be very dangerous to take hormones that are not our own hormones, birth control pills and prednisone and, the various steroids that have such a damaging effect on our health. And, most people that are taking these things don't really even understand what those effects are and how, deep-seated and long-lasting that they can be. And I think this is a tragedy. I think it's a tragedy for women that, no one tells these young women when they're having irregular periods, probably because they had some trauma in their childhood and their system hasn't developed properly, that then they put them on a birth control pill to correct that. This is crime.
Yeah.
A crime.
Yeah. And you're right. They don't know.
Yeah.
They don't understand. Yeah. It's so amazing. I'm listening to you, and I'm about to ask you how this helps to heal trauma. And so I'm just going to go ahead and ask you that question. But I just got so much out of what you said already.
Well, I was really kind of answering that question probably already, but it really is about that reconnection and, revisiting those disconnects and those blockages. And it's really also about, routing out the shadows. And we're really talking about rebuilding our humanness and our humanity. I was just, this little phrase just came to me in the last couple of days, because I was thinking about how what we call the immune system is really what all of the reductionist science is talking about when they're talking about how we remain human, meaning we don't degenerate into lower life forms. We actually become more identified as a human and functioning as a human. So, again, likewise, I think about what happens in cancer cells. Cancer cells have lost their humanness. They're cells that have, the symbolism of cancer is when there's a complete disconnect with the purpose and the function of that cell. So the symbolism can be like that part of the body is related to where there's a disconnect in the person's life in relationship to a particular trauma or a particular psychological conflict. And then those cells go and become rogue, behaving like fungal cells. They start to operate with anaerobic processes to make energy rather than the typical anaerobic respiration of a higher level eukaryotic type of cell. So it's, I'm not saying that these particular homeopathics can heal cancer. That's not at all what I'm saying, because that's a whole other level of supports that need to happen, but it's a foundational piece, certainly, to help people heal, to prevent cancer and to support people who do have cancer, and, most fundamentally reconnect to their innermost being and their highest self.
Wow, I love that. Gosh, yes, that is so clear. And I thank you for that message. I'm just going to say received. That was powerful. Thank you for that. From your perspective, what action steps can be taken to alleviate the burden of traumas and heal emotional wounds?
Well, one of the other things that I think is really fundamental when I think about folks that are really struggling through, varying degrees of symptoms or phenomenon that they may not even, know that it has something to do with a trauma. But I think practices that really help us settle into our bodies, help us really support us to feel relaxed and not, wired and tired. So, any kind of like adrenal supports, making sure that a person is getting solid sleep. We have a whole adrenal repair program that we give to patients. The concept of sleep hygiene. Like if somebody's not sleeping, a lot of times it can be because their brain wants to resolve those old traumas. And so, that's in the history. That's something else that might need to happen is, what is a way in which a person can be supported to work through some of those old emotional aspects. And, I definitely have to speak to this practice of heartfulness, this heartfulness meditation that I've been a part of for nearly 30 years now, where it's, simply a meditation on the heart, but there's a really key component to this method that's very unique. it's called the Heartfulness Cleaning, and anybody can access that either through, their podcast app, their YouTube. There's even a Hearts app now that will take a person through all of these practices. The cleaning is the one aspect of the whole meditation practice that I suggest people begin with. And it's not exactly a meditation where we think of meditation, and in this system, we do meditate on the heart. It's a passive practice, but the cleaning is more of an active practice, and you're actually strengthening your will each time you do it, because you're imagining that all the complexities are going out the back in the form of smoke or vapor. So when one does this, it's really just about doing it with the utmost confidence, belief, and trust that it's happening. And then toward the end, when you start to feel lighter, and when someone practices this, they really do start to feel the qualitative difference through the experience. Then you start to envision source, or, I tell people, whatever works for you, like, if God is the word, or if the absolute is the word, or if Christ consciousness is the word, or, whatever, like you feel that purity of the origin entering from the front and filling that void. This is a practice ideally is done for 30 minutes at the end of your workday, or, before you're too tired to sleep.
Yes.
I myself, I have a 6-year-old daughter, and she likes me to be in her room. It's just one of those habits when she goes to sleep. So I sit in my old nursing chair, and when she's fallen asleep, every night she says, "Mom, aren't you going to meditate in my room? Aren't you going to meditate in my room?" So, sometimes it's like, "Would you please be quiet so I can meditate?" But I just, I sit, I get my blanket on, we get the light out, and she usually just, she goes right to sleep.
Right to sleep.
And yeah, there's just so many initiatives going on with the heartfulness system, but I feel like this is such a fundamental piece, because people have to slow themselves down and calm themselves down when they feel so wound up and scared and frightful and reactive, stressed, as we don't say, that I think you've got to start with some of these really fundamental pieces so that you're not just going.
Yeah. I don't know that I'll ever think of the word stressed in quite the same way again after our discussion.
Awesome.
So how does one learn how to set boundaries after experiencing a trauma in order to heal?
Well, I think the first step is really understanding, developing that awareness of what that fallout of having poor boundaries, and watching how we ourselves don't have appropriate boundaries. It's really about respecting the autonomy of ourself and the autonomy of another person. And, when somebody may start to get irritated with you about something, you might want to think, well, let me reflect. Did I expect too much because I was, sending them 25 texts and they weren't answering me, or, whatever it is. So first step in any change of yourself is always awareness. And then second to that, I think, is, understanding what the boundary is that needs to be set. Meaning if, you have someone who behaves in such a way where they're, frequently getting angry and lashing out, or they're frequently, getting very irritable, and they're just blah, 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 that you can recognize that, when you start to get irritated, that they're starting to give their feelings to you, so that they alleviate themselves from those feelings. And then you say, wait a minute. I'm not taking on your emotions for you. That's your responsibility to feel through. And when we recognize that, we can simply say to the person, you have a habit of expressing your, whatever it is, angst, anger, frustration, irritability. You have a habit of pulling, other people into this, but I just need to let you know that I'm not going there with you.
Yeah.
Done. And it's really such a simple intervention, but it's an incredibly powerful concept that has, definitely helped a lot of my patients over the years, when I've kind of walked them through this process and explained them how to just, I know what the boundary is that needs to be set, and then just set it And, then, you might still be like having your heart race and, freaking out on the inside, but it's changing the ground out of which the relationship is set.
Perfect.
And shifting, what had happened historically between you and this person, there's not a good boundary with.
Right. Oh, I love that. Yeah. Oh boy. So a beautiful learning tool there. That's awesome. I thank you for that. One of my favorite questions is about freedom. What does freedom look like? Freedom from these traumas or the impact of these traumas in our lives and our bodies. How do we move forward?
Well, I really truly believe that we are only going to be free when we all learn how to listen to our inner being. And again, when we're going and reacting and acting out of fear and terror and survivalism or fear of death or when we really kind of step back and get this really holistic perspective, and we develop some habits where we can really listen to our inner being, what my mentor, Dr. Gagnon, used to call the driver. It's like you have the car and you have the person inside. It's like, the body is the car, and then you have this person inside, the driver, the consciousness that's having this experience. The only freedom that we really have is to listen to what we're meant to be doing and to follow that. That's the true freedom. And, anything else less than that isn't really leading us down the path that is serving our greatest good and serving, the greatest good of humanity. And, I think of as the universe as a whole, but we're the metaverse. If you want to keep taking that.
Yes, absolutely. Right? Yeah. Oh, that's awesome. That's awesome. I can't even begin to thank you for this time. Do you have a free gift that you want to share with the audience?
Absolutely. We have a nice little package of explaining to people how they would do and take the OM program. So we certainly have an article that we can link with that's on our website, but it would explain how you would do that program.
Oh, lovely. That sounds like a treat and a half. So I really look forward to reading it and learning more about the OM program. So I just really want to take a moment to thank you from the bottom of my heart for this time. This has been awesome, very much an instructional opportunity for us. So I am grateful beyond measure on behalf of our audience. Thank you.
Thank you for having me. I hope that people get some benefit out of it and learn something and are able to implement a little bit of healing and shifting any suffering that they may be in.
Yeah. Well, I can guarantee if they were listening, they did get something tremendous out of it. And it is my greatest hope that they will implement some of these techniques and connect.
Awesome.
Connect with you when the time is right. Thanks
Thank
again.
you so much, Beverly. Appreciate it.
My honor.